Diabetic neuropathy is a type of nerve damage that can occur if you have diabetes. High blood sugar can injure nerve fibers throughout your body, but diabetic neuropathy most often damages nerves in your legs and feet. As we say this, welcome our favorite foot doctor, Ira Kraus from Advanced Foot Care Centers. You told me, is this April diabetic?
Yeah, it's diabetic awareness. Usually, okay. I think April and November are a couple of different months that people do diabetic awareness time. There's a couple of months out of the year where we kind of focus more a little bit on that educational portion of diabetes.
Let me just explain this in a simple way that people can understand how much trouble this is. If your arm falls asleep, this is what it's like if you're diabetic when you have no feelings in your feet.
Yep.
But this is 24 hours a day.
You know, I'm going to tell you an interesting story. When I first came to Chattanooga, my first diabetic patient, I was 25 years old, new practitioner in town, and a gentleman came into me. I didn't really understand everything. He was an old country fella, and he had a wood coal stove, and he came into me with gangrene on his big toe because he built a fire and put his foot next to the fire and burned his foot because that was my first experience with a true diabetic patient in private practice who had no feeling in their feet, and it's made a mark on me for my whole career.
You have, you stop by your office, any office, you take care of all of these patients, especially a lot of the people who just can't afford the health care. You will see everybody. But listen, for diabetics, why is it so important to take care of their feet? Is it because they're that is so far away from the heart?
Well, that's why it's called distal neuropathy. It's actually distal, the most distal part of the body. So what happens is what we see in our diabetics is we see distal neuropathy develop, and we see vascular problems happen. And a lot of times there's an overlap, Jed. There may be people who are getting numbness and tingling in their feet that think, oh, it's just my diabetic neuropathy, that's what my primary care doctor told me. But in fact, it could be that there's decreased circulation. So we have to take both components into effect and look at that. But prevention is the most important thing.
You talk about simple things like just putting cream on your feet,
yes,
because the feet of diabetic patients can crack so often.
Exactly. What happens with the neuropathy and with vascular disease is that the skin will dry out and crack. That's where we see what's called heel fissures or skin fissures, and they can become infected. They become painful. Even, you have to understand, if a neuropathic patient comes to you and says they have pain, do you know how much pain you would be in as a normal person? Their nerves are dead. For them to get that level of pain, it's got to be worse. So you got to prevent it. They can become infected. That's how they lose limbs. Prevention is the key with our diabetic patients.
Even the importance of cutting your nails correctly, stepping on a nail, even getting infected.
Yep.
This is so important for diabetics.
Cutting your nails regularly, straight across. I have patients who use wire clippers and cut themselves and get infections. They really need to get the care of a professional so that they can prolong everything with their feet.
Let me ask you, when it comes to shoe wear, does that help diabetics as well?
Without
a doubt. Actually, we've seen some shots of shoes, but they're pretty hip these days.
They are.
They're not ugly like they used to be.
I used to call them moon shoes. They were diabetic shoes. When we looked at them, they were ugly. People hated them. You know, now you can buy a New Balance. You can buy a Brooks. There are some really nice red feet. You know, there are nice shoes that are out there, but the key is the insole, because what happens is it's a special durometer thickness of an accommodative material that heat molds to your feet, or we can make a custom molded one to accommodate calloused areas or bones that are out of place. The whole key is to prevent friction and abrasion so that you don't get an ulceration. That's what the diabetic shoes do.
Does insulin have any impact on your feet as well? Or, I mean, I know that saves your life if you're a diabetic, but does that hurt or help your feet?
Well, insulin, if you can get your sugar under better control with the use of insulin, it can help slow down some of the progressive deformities that are going on. But insulin is used systemically just to treat diabetes as a whole. But if we can get the diabetes under control, we can prevent some of the other complications that happen.
Listen, it's summertime. A lot of folks wearing sandals, clogs. You've got a great machine that is FDA approved that gets rid of the nail fungus. And man, that stuff is nasty.
Yeah, we just got a really new, I'm excited. It's a new antifungal toenail laser. It works on light therapy. So it has these little pods that go on the toes, and it uses light therapy to kill the fungus, and it doesn't cause heat. Like a lot of the other lasers do heat therapy so people get burned. We do no heat. It's light therapy.
We don't have to watch those commercials where the guy's opening up the heel, the little cartoon character?
No, you don't have to worry about Digger the dermatophyte.
So this is good.
Yes.
How many treatments do you need?
We do up to 3 treatments.
Okay. 100%?
85% successful. That's what the information is saying.
Ira, if you could look at that monitor, look how good you look with that vest on, man. You look fantastic, buddy. You just fit right in. Once again,
I love the new studio. I love the new studio. Congratulations to you guys.
I'm moving in. Thank you. Thank you, Ira. Advanced Foot Care Centers, 698-1966. 7 locations?
6.
6 locations. The newest one is in St. Elmo. AdvancedFootCareCenters.com. Ira, I know you're going somewhere because you travel all over the world. Whatever you do, safe travel. I'll just make it simple. We're back with 3 Plus U after this.